The U.S. military is taking the EMP threat very, very seriously. Vendors and consultants we're working with are doing multiple projects for military installations around the world, both in NATO countries and domestically here in the U.S. and even over in Hawaii. There's a lot of infrastructure improvements to get military installations completely off-grid, completely EMP protected, that if the civilian grid goes down in that local area, they're completely standalone and independent. Stateside, where we're tied to the civilian infrastructure, critical facilities are increasingly being sent, we're sending RFPs to develop hardened infrastructure for military sites for their critical infrastructure. Outside the military, the largest demand that I'm seeing in our business for EMP hardening is in the data center telecommunication realm. The ability to process transactions in a collapse environment is going to be critical to staving off social unrest. So there's a very valid reason for that. But there's another valid reason for that. Those data centers are high profit producing centers. Some of these, one we worked on in Creve Coeur, Missouri, was something like $4.5 million an hour. So they're very, very high net worth producing. So preventing all types of disaster is important to those guys. I've done some hospital work. I have a history of that. I've done hospital infrastructure work. I've done generators and systems for oxygen tanks and things like that are critical to keeping the hospitals operational. However, I have yet to see a single hospital request that we do EMP hardening. I've been on staff with hospitals as a consultant, Sutter Health in Oakland, Kaiser Permanente, and throughout the San Francisco Bay Area. We see a large bureaucracy at hospitals that's hard to penetrate to get them to think new, think out of the box. We're a country with a lot of problems with hospital-acquired infection. We have 99,000 fatalities a year for hospital-acquired infection. Other countries, the staff must have their uniform washed on site, not wear it home, and lots of other infection prevention measures. And so if we can't cross that hurdle, it's going to be even harder to cross the hurdle with EMP, since it seems an outlier to the general public at large. So I think there needs to be a focus on moving the hospital infrastructure towards understanding this is a real event. It's a statistically imminent event. Would you combine the threat between solar GMP, geomagnetic storms, and a possible rogue event with a nuclear triggered HEMP event. Every weapon we've ever thought of, we've deployed at some time. And statistically, 1859, 1989, 2012, 1922, there's been geostorms one after another. And it's just a matter of time before it hits somewhere in the U.S. and has a critical infrastructure damage. I learned more about how much the military is doing, which should be compelling to us. I learned how easy it is technologically to protect our major transformers. The shunt trip capacitor technology is not nearly as intrusive or as complex to build as the EMP protected structures I've been around as an architect that are, mil-spec 188, 125, fully welded steel box with special penetrations and special doors and all kinds of, $500 a square foot special spaces. Protecting those generators is critical to the United States and especially Texas's infrastructure, and it's a simpler task to add the capacitors on the incoming outgoing lines to protect those units.